bring Sheena up to speed a little bit. When we talk about patients, we are usually looking at two things. We're looking at two basic groupings. So the first thing we look at is their emotions and what they are blocking. The most pathology is due to a conflict between emotions. They don't want the emotion, they're embarrassed about the emotion, they're guilty about the emotion, so they try to bury it. There's all kinds of ways to bury it. There's very unhealthy ways to bury it, psychosis, and there's more healthy ways to bury it, humor, joking, and there's a whole gray area in between. Those are called defenses. So when you block something, you're defending against it. So that can cause, it's the defending that causes all the problems. But our patients mostly think it's the emotion that's the problem. And the three emotions that most people block against or have conflicts with are joy,
anger, neediness, and sadness.
Yes. Those three have been labeled by people growing up as bad, wrong, weak, whatever it is. So they are not displaying them correctly. So these defenses get them in trouble and in trouble and in trouble. And they finally come in going, with whatever that shows. We deal with that first. We try to help them normalize the emotions and take on more mature, healthier defenses. Because there are times we can't show negative emotions, and we shouldn't just be displaying them or talking about them. But at some point, we have to deal with them. These people are not. Okay. That's all mood disorders. Then we have
anxiety, depression.
Right.
Those are the mood disorders.
Exactly, right. Bipolar disorder, as opposed to the psychosis, which are in that very ill, really poor defenses. You don't treat those. That's more medication. We do have great medications for, they're better than any other for any other mood disorders.
There's also some injectables.
Yeah, they'll last for 2 weeks or more. So they can be compliant. Okay, so that's for the mood disorders. And then we have personality disorders. That's trickier, much harder, because you're developing a relationship. Personality disorder, in psychiatric terms, means somebody who cannot tolerate intimacy. Okay, say that. But the flip side of that is they also can't tolerate abandonment or can't tolerate being left. So in a healthy relationship, you're getting close and you're distancing, and you're getting close and you're distancing, you're getting close and you're distancing. They move back and forth, right, between them. But personality disorder people can't handle closeness, usually because it feels like being taken over, and they can't handle distance because it feels like abandonment. So there's a lot of drama around these two. So they try to stay right here. But healthy people see this and it drives them crazy because they're being pulled in and spit out, pulled in and spit out. So they respond to that. They just, you feel that crazy drama. What's going on here? People don't understand. The personality disorder patient this is their mission, not you, not the relationship. So that's very hard to get to because we're in therapy. It's a relationship. So they're doing to us. And a lot of times they can't stay. It's very hard for personality disorder patients to stay in therapy. And that's what the insurance companies miss, because the only way they're going to get better is to stay with you as much as possible to work that out. And that's usually at least 3 times a week. I've had patients come 5 times a week who are extremely personality disorder and are now better. Now I'm actually married with a kid. So this happens, and we have to do that second. So because it's so difficult to get to, and you need a very strong trust for them to work on that. We do the mood disorder stuff first. Then if they're still around and feel they got benefit from that, which is what usually happens, they want to move into this personality disorder stuff. So we're talking about new patients, we're often talking about the mood disorder stuff. When we talk about people who are mid-phase, we're talking more about the personality disorder stuff.